Imagine being able to save a life just by looking into someone's eyes. Sounds like magic, right? For pediatric patients, certain ocular signs can reveal hidden systemic diseases that demand urgent attention. Through riveting case studies and detailed discussions, global experts at WCPOS 5 2024 put on their detective hats to examine the clues held within the eye that can help identify critical conditions and ultimately save young lives. According to Dr. Susmito Biswas, 1/3 of inherited metabolic diseases present ocular features, with 30% affecting the anterior segment and 50% the posterior. He shared a case of a child with Wolman disease, a condition linked to variants in the LIPA gene. This disorder manifests as crystals in the peripheral cornea and changes in the posterior lens capsule. If left untreated, it can cause death, Dr. Biswas cautioned. He emphasized the importance of considering the overall health and family history of the child, urging clinicians to refer for metabolic workups and, if possible, whole genome sequencing for definitive diagnosis. Hannah Skanga explored the link between iris flocculi and thoracic aortic aneurysm dissection, or TAD. The disease is linked to a hotspot within the ACTA2 gene and the MYH11 gene. Hannah Skanga stressed the crucial role of genetic testing and comprehensive evaluations, saying, "It may seem like the family history is negative, but actually there just wasn't anybody expressing it enough from a vascular perspective." She then posed an intriguing question: can iris flocculi predict TAD risk in family members? Although her study of 13 children did not find ACTA2 gene variations in those with iris flocculi, Hannah Skanga continued to recommend genetic testing because the benefit to risk ratio from doing the test outweighs the risk of missing the diagnosis, especially when family history seems unremarkable. "It'll help us make sure that we're taking care of not just our patients, but the family as well," she concluded. Dr. Karthikeyan Arkat Sadagopan shared a compelling case involving a young girl that presented with reduced vision and retinal pigment epithelium modeling. Her younger sibling had died recently due to intracranial bleeding. Examination of the sibling's medical records revealed clues that pointed to Alagille syndrome. Ultrasonography studies show optic disc drusen in at least one eye in 90% of children with this genetic disorder. Dr. Sadagopan concluded with a powerful remark: "The eye only sees what the mind knows," reminding us that we can only identify underlying conditions if we're aware of the link to ocular signs, if we know what to look for, and if we perform the necessary diagnostic tests. Recognizing ocular signs can save lives, especially in pediatric patients. By understanding these indicators, ophthalmologists can diagnose systemic diseases early, leading to timely and potentially life-saving treatments. Stay informed, stay vigilant, and remember, the eyes can reveal more than we ever imagined.